Today I'm going to talk about a really awkward, difficult subject. Crohn's disease and ulcerative colitis patients get these fissures, or tend to get these fissures called anal fissures. They are horrible. They descend down through the colon, through the rectum, out into their skin, down their leg, places like that. It's miserable. It's a miserable complication, if you can imagine. If you had friends who've had this, or family, or you've had this, you know what I mean. Historically, no real way to treat that. I know they try weirdly diltiazem powdered on it, or liquid, and that kind of helps it, but I've got a better help for it. Crohn's disease or ulcerative colitis, as you know, I think is mostly related to PEMT. The vast majority of cases are going to be related to PEMT or caused by PEMT. PEMT is a genetic condition that hasn't been well known as causing all these diseases like liver failure, hepatitis, non-alcoholic hepatitis or steatohepatitis, fatty liver disease, gallbladder disease, pancreatitis. If you have any of those, you need to be checked. Check your genetics for PEMT. You treat it with phosphatidylcholine, but we found what really helped was our glutathione that was built with phosphatidylcholine in the liposome, a natural liposome we used. And that seemed to really do the job. All kinds of studies on how glutathione helps with PEMT and rejuvenating your hepatocytes or liver cells. But more importantly, topical glutathione on those anal fissures is almost magical. For years, I was in a cosmetic reconstructive plastic surgery group. I dealt with complex wound issues. When we first discovered our glutathione, Nayan Patel and Shintron and I were doing the work down in La Habra on it. And those guys were the ones who invented it, really. And I helped them get patents on it, helped do the clinical work on it. And so we knew what all I could do. We found out it really helped with wound healing, like leaving no scar, like doing all kinds of cool things with wounds, burns, things like that. And it really fit into what kind of work I was doing back in Utah. Nayan Patel got interviewed by Gary Brecka about that glutathione that I was involved with also. You need to go look at that interview. We get the Glutaril in our office and are able to sell it. And it's that glutathione we developed. You spray that on 4 or 5 times a day and on any wound, and it's amazing what happens. So, and again, PubMed validates that with studies about wound healing and glutathione. You can go search those up and look at them. But for anal fissures, it's crazy. Works really well. So no, that's another option. It really burns and stings when you first apply it, horribly so. But eventually it just starts the healing. And it's like the diabetic foot ulcers we also deal with it. It's pretty cool, but you know, the PubMed says it should work, and it does. It's the only validated, absorbable, reduced, stable, topical glutathione in the world.